If you are over 60 and sexually active, there is a window of time right after intimacy, roughly 30 to 60 minutes, that most people completely ignore. They clean up, they get comfortable, they go to sleep. And in doing so, they miss one of the simplest and most effective opportunities available to protect their urinary tract, their bladder, and in ways I am going to explain carefully, their brain. What you drink in that window and what you choose not to drink matters more than most people realize. And today I'm going to walk you through exactly what the science says and exactly what I recommend to my own patients. This is not about miracle cures. This is not about any single ingredient that rewrites your biology overnight. This is about understanding what your body is doing in the hour after intimacy, what it needs to do that job well, and how to give it the right tools at the right moment. That is what good medicine looks like. That is what this channel is about. I want to be honest with you up front, the way I always try to be. Nothing you drink after intimacy prevents sexually transmitted infections. That conversation belongs in a different video, and I have had it. What we are talking about today is urinary tract health, specifically the conditions that allow bacteria to take hold in the bladder and travel upward, the conditions that make the aging urinary system more vulnerable, and the drinks that genuinely support your body's natural clearance mechanisms in the critical post-intimacy window. I'm Dr. Mariana, a urologist with over a decade of clinical experience working with adults over 50 on the health questions that matter most and get discussed least. Urinary tract infections in older adults are one of the most underestimated health threats I encounter in my practice. Not because they are exotic or complicated, but because they are so preventable and yet so consistently allowed to develop through simple gaps in daily habit. Today we are closing one of those gaps. If you are new here, please subscribe and leave a like. It genuinely helps this content reach the people who need it. And drop a comment below telling me where in the world you are watching from. I love knowing how far this community extends. Let's begin with what is actually happening in your body after intimacy, because the rationale for everything I am about to recommend lives in this biology. During intimacy, bacteria from the external skin and environment are introduced to the urethral opening. In younger adults, a strong urinary stream and a robust local immune response clear most of this bacterial introduction rapidly and automatically. After 60, both of those defenses have weakened. The urinary stream is often slower due to prostate changes in men and pelvic floor changes in women. The mucosal lining of the urethra is thinner, less defended, and more permeable. The local immune cells that patrol this tissue are slower to respond. The window between bacterial introduction and bacterial attachment, the window in which you can intervene mechanically, is shorter than it was. What you do in the 30 to 60 minutes after intimacy directly determines whether bacteria that entered the urethra during that encounter get flushed out before they cause a problem, or whether they are left in a warm, moist, nutrient-rich environment to multiply undisturbed. The first and most important drink is plain water, but the amount, the timing, and the intention behind it matter enormously. One full glass of water, at least 250 milliliters, drunk immediately after intimacy, before sleep if the encounter happens at night, does two things simultaneously. It begins increasing urine production within 20 to 30 minutes, which gives you a second natural flush beyond the immediate post-intimacy void. And it reverses the mild dehydration that most adults over 60 are carrying without realizing it. The thirst mechanism becomes significantly less sensitive with age. The body stops sending clear, urgent signals the way it did at 30. The result is that a large proportion of older adults are chronically mildly dehydrated, producing concentrated urine that is a far more hospitable environment for bacterial growth than well-diluted urine. Concentrated urine is warmer, richer in the nutrients bacteria thrive on, and less acidic, all conditions that favor infection. Diluted, well-hydrated urine is the opposite. It is one of your bladder's most reliable natural defenses, and you restore it with something as simple as a glass of water at the right moment. The second drink worth understanding is unsweetened cranberry juice. And I want to be precise here, because the popular understanding of cranberry and UTIs is both partially right and significantly oversimplified in ways that lead people to make poor choices. The active compounds in cranberry that matter for urinary health are called proanthocyanidins, specifically a type called PAC-A. These compounds have been studied for their ability to interfere with the ability of certain bacteria, particularly E. coli, to adhere to the walls of the bladder and urethra. Think of the bladder wall as a surface that bacteria need to grip in order to establish an infection. PAC-A compounds make that surface slippery. They do not kill the bacteria, they prevent them from finding purchase. The evidence for this mechanism is real and well established in laboratory conditions. The clinical picture is more nuanced. The benefit appears most meaningful for people who experience recurrent UTIs, and it requires actual cranberry, not cranberry cocktail, not cranberry-flavored drinks loaded with added sugar, not cranberry supplements of uncertain Pack A content. Unsweetened cranberry juice, a small glass of roughly 150 milliliters in the hour after intimacy, is a reasonable and evidence-informed addition to the post-intimacy routine for adults who experience recurrent urinary tract infections. For people who have never had a UTI, the benefit is less clear, and plain water remains the priority. Sugar, by contrast, actively feeds bacterial growth, so any cranberry product with significant added sugar is, from a urinary health perspective, counterproductive. I want to pause here and ask you directly. Have you ever experienced a UTI that you believe was triggered by sexual activity? Drop a comment below. You do not need to share details. A simple yes or no tells me a great deal about what this community is navigating, and it may help someone else watching feel less alone in an experience they have never spoken about. The third addition worth discussing is warm water with a small amount of fresh lemon juice, and the mechanism here is different from what most people assume. The benefit is not primarily about vitamin C, though vitamin C has its own role in urinary health that I will come to. The primary benefit of lemon in water for the urinary tract is citrate, the salt form of citric acid that forms when lemon juice meets water. Urinary citrate is one of the body's natural inhibitors of crystal formation in the kidney and bladder, which is relevant not just for kidney stone prevention, but for the overall health of the urinary lining. A lining that is not chronically irritated by crystal microdeposits maintains its integrity better, which means it is less vulnerable to bacterial adhesion. A warm glass of water with the juice of half a fresh lemon in the hour after intimacy is a simple, inexpensive, and genuinely supportive habit for aging urinary health. The warmth also matters. Warm fluids stimulate bladder activity and encourage voiding, which is precisely what you want in this window. The fourth consideration is what not to drink, and this is equally important. Alcohol, consumed in the hours around intimacy, is a urinary irritant, a diuretic, and an immune suppressant simultaneously. It irritates the bladder wall directly, making it more susceptible to bacterial adhesion. It increases urine production without increasing the fluid volume that matters. It accelerates dehydration rather than correcting it. And it suppresses the local immune activity that represents your body's last line of defense against early-stage bacterial colonization. A glass of wine before intimacy is a social reality for many people, and I am not here to eliminate pleasure from your life. But alcohol immediately after intimacy, in the window when your body is trying to clear a bacterial challenge, works directly against the process you are trying to support. Coffee and other caffeinated beverages have a similar, though less severe, bladder irritant profile. If your post-intimacy routine currently includes a nightcap or a late coffee, replacing either with a glass of water is a genuinely meaningful change. The fifth drink is one that surprises most of my patients: a small amount of unsweetened coconut water, roughly 100 milliliters added to your glass of plain water. The reason is electrolyte balance. Proper hydration is not just about water volume. It is about the minerals that allow water to move efficiently across cell membranes and into the tissues that need it. Many older adults drink adequate water by volume, but remain functionally underhydrated at the cellular level because their electrolyte balance, particularly potassium and magnesium, is insufficient to facilitate proper fluid distribution. Coconut water provides both in natural form, without the added sugars and artificial compounds found in commercial sports drinks. A small amount alongside your post-intimacy glass of water improves cellular hydration more effectively than water alone. This matters for the urinary system because properly hydrated urinary epithelium, the cells lining the bladder and urethra, maintains its barrier function more effectively than dehydrated tissue. Let me tell you about Margaret, a 72-year-old patient of mine who came to see me after her third UTI in 18 months, all of which appeared to follow intimate encounters with her partner of 2 years. She was frustrated, slightly embarrassed, and had begun quietly avoiding intimacy because the infections had become so disruptive. When I walked her through her post-intimacy habits, she described going immediately to sleep after encounters that happened at night, drinking nothing, waking 4 to 5 hours later with the early symptoms of another infection. We built a simple protocol together: void immediately, Drink a full glass of water with lemon, rest, void again within the hour. Within 6 months, she had not had a single recurrent infection. She came back to tell me that she felt like she had been given her intimate life back, that a few minutes and a glass of water had returned something she had been quietly grieving. She said, with the particular dignity of a woman who had decided to stop apologizing for her needs. I just needed someone to tell me what to actually do. That is what I am here for. I want to speak to anyone watching this who is over 65 and has begun treating recurrent infections, fatigue, and cognitive fog as simply the cost of getting older, something to manage rather than investigate. I want you to hear this clearly. Chronic low-grade urinary tract infections, inadequate hydration, and the resulting inflammatory burden on the aging brain are not inevitable. They are addressable. The habits that support your urinary health support your neurological health. The water you drink in the hour after intimacy, the void you take before sleep, the lemon in your morning glass, these are not small things. They are direct investments in the clarity, the energy, and the dignity of the years ahead of you. Here is your complete action summary. Immediately after intimacy, urinate fully and intentionally. Within 10 minutes, drink a full glass of plain water. Within the hour, add lemon juice to warm water and drink again, aiming for a second void before sleep. Consider a small amount of unsweetened cranberry juice if you experience recurrent UTIs. Add a splash of unsweetened coconut water to improve cellular hydration. Avoid alcohol and caffeine in the post-intimacy window. And remember, none of this replaces barrier protection or regular STI screening. It works alongside both. Your 30-day challenge. Implement this post-intimacy hydration routine every single time for 30 days. Keep it simple. Water, lemon, void. Build the habit until it is automatic. Notice whether your urinary comfort, your sleep quality, and your morning clarity begin to shift. They often do. If this video gave you something practical and honest, please subscribe and leave a like. And in the comments below, I want your answer to this. Which of these drinks are you adding to your routine first, and why? Tell me below. I will be reading every response. Aging is not the end of vitality. It is an invitation to live smarter.